Assalamu alaikum. Ultrascan Diagnostics here. This is the CBCT of the patient that you had requested. The area of interest is the lower right and the lower left wisdom teeth. Now, on the panoramic view, you can see that the wisdom teeth are very closely associated with the inferior alveolar nerve on either side. Now, we're going to show you the transaxial view of the lower left wisdom tooth first, and then we'll take you to the lower right wisdom tooth. Now, this is the lower right, left wisdom tooth. This is the mesial root. You can see the mesial root is approximately just a millimeter away from the inferior alveolar nerve. So I'm going to zoom in for our doctor so that they can see more clearly. So this is just a millimeter away. As we're moving more distally, you can actually see that the mesial root apex actually touches or it comes in contact with the inferior alveolar nerve canal. Moving to the distal aspect, you can see that the distal root is quite significantly associated with the inferior. It's not looping around it, but the apex is actually touching the inferior alveolar nerve canal. I'm going to remove the highlight so that the doctor can actually see how it's compressing. So this here is the inferior alveolar nerve canal, and this is the apex. So this and this. So this is where the compression actually happens. And here we can see that the mesial root apex is actually also in contact with the inferior alveolar. So it's not looping around it, but extraction of said wisdom tooth should be done with consideration that there might be some damage to the inferior alveolar nerve canal, and hence the patient should be informed about the risks associated with it. Now moving to the lower right inferior alveolar nerve and the lower right wisdom tooth. This is the lower right wisdom tooth mesial root. This is the inferior nerve. Again, just on top of it. It's not looping around it. It's not completely compressing it, but it is in contact with the inferior alveolar nerve. And as we will move towards the distal root, you'll be able to see that the distal root again is in intimate contact with the inferior alveolar nerve canal. So this is the inferior alveolar nerve canal, and this is the apex here and there. So this is what the situation is on the transaxial view. This is the axial view. The axial view is basically the top to bottom view, and this will show you that the inferior alveolar nerve is very closely associated with both these wisdom teeth on both the sides. If you have any further questions that we might be able to help you with, please reach out to our team. Thank you very much.